1. What is the primary function of insulin in the body? A. Helps regulate blood pressure. B. Stimulates the release of glucagon. C. Regulates blood glucose levels. D. Promotes protein digestion. Answer. Regulates blood glucose levels. Rationale. Insulin is essential in maintaining blood glucose levels by facilitating glucose uptake into cells. It does not directly influence blood pressure, glucagon, or digestion. Blood glucose regulation is its key role, particularly in diabetes management. 2. Which hormone is most responsible for regulating the metabolism of thyroid hormones? A. Thyroid-stimulating hormone, TSH. B. Cortisol. C. Insulin. D. Adrenocorticotropic hormone, ACTH. Answer. Thyroid-stimulating hormone, TSH. Rationale. TSH is responsible for stimulating the thyroid gland to produce thyroid hormones, T3 and T4, which regulate metabolism. Cortisol, insulin, and ACTH have different functions, not directly linked to thyroid hormone regulation. 3. A patient presents with fatigue, weight gain, cold intolerance, and constipation. What is the most likely diagnosis? A. Hyperthyroidism. B. Hypothyroidism. C. Adrenal insufficiency. D. Diabetes mellitus. Answer. Hypothyroidism. Rationale. The symptoms of fatigue, weight gain, cold intolerance, and constipation are classic signs of hypothyroidism, where the thyroid gland produces insufficient thyroid hormones. Hyperthyroidism presents with opposite symptoms such as weight loss and heat intolerance. Adrenal insufficiency may cause fatigue, but not the other listed symptoms. 4. What is the most common cause of hyperthyroidism in adults? A. Thyroid cancer. B. Graves' disease. C. Hashimoto's thyroiditis. D. Iodine deficiency. Answer. Graves' disease. Rationale. Graves' disease is the most common cause of hyperthyroidism, characterized by an overactive thyroid gland. Thyroid cancer and Hashimoto's thyroiditis are associated with thyroid dysfunction, but not typically with hyperthyroidism. Iodine deficiency leads to hypothyroidism, not hyperthyroidism. 5. Which laboratory test is most commonly used to diagnose diabetes mellitus? A. Hemoglobin A1C. B. Blood glucose levels. C. Serum cortisol levels. D. Thyroid-stimulating hormone, TSH. Answer. Hemoglobin A1C. Rationale. Hemoglobin A1C reflects the average blood glucose level over the past 2 to 3 months, making it a primary test for diagnosing diabetes. Blood glucose levels are also important, but may vary throughout the day. Cortisol levels are used for adrenal disorders, and TSH is used for thyroid function testing, not for diabetes diagnosis. 6. A 40-year-old woman with a history of type 1 diabetes mellitus presents with confusion, rapid breathing, and fruity-smelling breath. What is the most likely complication? A. Diabetic ketoacidosis, DKA. B. Thyroid storm. C. Hyperosmolar hyperglycemic state, HHS. D. Adrenal crisis. Answer. Diabetic ketoacidosis, DKA. Rationale. The symptoms of confusion, rapid breathing, and fruity-smelling breath are classic signs of diabetic ketoacidosis, DKA, a complication of uncontrolled type 1 diabetes, where ketones build up in the bloodstream. Thyroid storm, HHS, and adrenal crisis have different clinical presentations, such as altered mental status, but the fruity odor of the breath is specific to DKA. 7. What is the most appropriate initial treatment for an acute episode of adrenal crisis? A. Administer 4 fluids and hydrocortisone. B. Give oral prednisone. C. Administer insulin. D. Start thyroid hormone replacement. Answer. Administer 4 fluids and hydrocortisone. Rationale. Adrenal crisis is an acute life-threatening condition due to insufficient cortisol. Immediate treatment involves intravenous fluids and hydrocortisone to replace the deficient hormone. Insulin is used for diabetic emergencies, not adrenal crisis, and thyroid hormone replacement is for hypothyroidism, not adrenal insufficiency. 8. Which of the following is a common complication of untreated hyperthyroidism? A. Stroke. B. Osteoporosis. C. Asthma. D. Cushing syndrome. Answer: osteoporosis. Rationale: chronic untreated hyperthyroidism can lead to bone loss and osteoporosis due to increased metabolic rate and calcium imbalance. Stroke and asthma are not directly associated with hyperthyroidism, and Cushing syndrome results from excess cortisol, not thyroid hormones. 9. A patient with type 2 diabetes is receiving insulin therapy. What is the primary goal of this treatment? A. Cure the diabetes. B. Regulate blood glucose levels. C. Improve renal function. D. Reduce insulin resistance. Answer: regulate blood glucose levels. Rationale: the primary goal of insulin therapy is to regulate blood glucose levels in patients with diabetes. Insulin therapy does not cure diabetes, nor is it primarily used to improve renal function or directly reduce insulin resistance. While insulin helps manage glucose levels, other medications may be used to address insulin resistance. 10. Which of the following is a key preventive strategy for type 2 diabetes? A. Increased iodine intake. B. Regular physical activity. C. Reducing cortisol levels. D. High protein diet. Answer: regular physical activity. Rationale: regular physical activity helps maintain healthy blood glucose levels, reduces insulin resistance, and is a key preventive strategy for type 2 diabetes. Iodine intake is related to thyroid function, not diabetes. Cortisol levels are related to stress, and a high-protein diet does not specifically prevent type 2 diabetes. 11. What is the most appropriate treatment for hyperthyroidism due to Graves' disease? A. Methimazole or propylthiouracil. B. Insulin therapy. C. Corticosteroids. D. Thyroid hormone replacement. Answer: methimazole or propylthiouracil. Rationale: methimazole or propylthiouracil are antithyroid medications used to treat hyperthyroidism by inhibiting the synthesis of thyroid hormones. Insulin therapy is used for diabetes, corticosteroids are used for adrenal disorders, and thyroid hormone replacement is used for hypothyroidism. 12. A patient with hypothyroidism is prescribed levothyroxine. Which of the following statements about this medication is correct? A. It should be taken with food. B. It should be taken on an empty stomach. C. It should be taken at bedtime. D. It is usually taken with calcium supplements. Answer: it should be taken on an empty stomach. Rationale: levothyroxine should be taken on an empty stomach, typically 30 to 60 minutes before breakfast, to enhance its absorption. Taking it with food or calcium can decrease its effectiveness. Taking it at bedtime is not ideal as it can interfere with absorption due to the food intake at night. 13. A 25-year-old female with a history of polycystic ovary syndrome, PCOS, is concerned about fertility. Which of the following is a common feature of PCOS? A. Hypothyroidism. B. Insulin resistance. C. Hyperthyroidism. D. Hypertension. Answer: insulin resistance. Rationale: insulin resistance is a common feature of PCOS, leading to an increased risk of type 2 diabetes. Hypothyroidism and hyperthyroidism are thyroid-related disorders, and hypertension is not a defining feature of PCOS, although it may occur due to other factors. 14. A patient presents with a blood glucose level of 650 milligrams per deciliter and signs of severe dehydration. Which condition is most likely? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Adrenal crisis. D. Hypoglycemia. Answer: hyperosmolar hyperglycemic state, HHS. Rationale: HHS is characterized by extremely high blood glucose levels, often greater than 600 milligrams per deciliter, and severe dehydration. It primarily occurs in type 2 diabetes. DKA typically presents with lower blood glucose levels and metabolic acidosis. Adrenal crisis and hypoglycemia do not typically present with these extreme blood glucose levels. 15. What is the most appropriate nursing intervention for a patient with newly diagnosed diabetes mellitus? A. Teach the patient how to monitor blood glucose. B. Instruct the patient to avoid all carbohydrates. C. Encourage the patient to avoid exercise. D. Advise the patient to immediately start insulin therapy. Answer. Teach the patient how to monitor blood glucose. Rationale. Educating the patient on how to monitor blood glucose is crucial for managing diabetes. Avoiding carbohydrates and exercise may worsen the condition, and insulin therapy may not be required initially for type 2 diabetes. Proper education on blood glucose management is essential to prevent complications and improve control. 16. A patient with a history of chronic corticosteroid use is at risk for developing which condition? A. Cushing's syndrome. B. Hyperthyroidism. C. Adrenal insufficiency. D. Diabetes insipidus. Answer. Cushing's syndrome. Rationale. Chronic corticosteroid use can lead to Cushing's syndrome due to excess cortisol. This can result in weight gain, increased blood pressure, and other symptoms. Hyperthyroidism and diabetes insipidus are unrelated to corticosteroid use, and adrenal insufficiency can occur in patients who suddenly stop corticosteroid therapy but is not the direct result of long-term use. 17. Which of the following is a complication of uncontrolled diabetes mellitus? A. Diabetic retinopathy. B. Hypothyroidism. C. Hyperparathyroidism. D. Acromegaly. Answer. Diabetic retinopathy. Rationale. Diabetic retinopathy is a common complication of uncontrolled diabetes and involves damage to the blood vessels in the retina, potentially leading to blindness. Hypothyroidism and hyperparathyroidism are not common complications of diabetes, and acromegaly is caused by excessive growth hormone, not diabetes. 18. A patient with diabetes is experiencing signs of hypoglycemia, including sweating and shakiness. What is the best initial action? A. Give the patient a glass of water. B. Administer a dose of insulin. C. Provide 15 grams of fast-acting carbohydrate. D. Encourage the patient to rest. Answer. Provide 15 grams of fast-acting carbohydrate. Rationale. The best initial action in hypoglycemia is to provide 15 grams of fast-acting carbohydrate, such as glucose tablets or fruit juice, to quickly raise the blood sugar level. Administering insulin would worsen the hypoglycemia, and water or rest does not address the immediate need for glucose. 19. What is a primary function of cortisol in the body? A. It regulates blood sugar. B. It enhances thyroid function. C. It promotes bone growth. D. It regulates the immune response. Answer. It regulates blood sugar. Rationale. Cortisol helps regulate blood sugar by promoting gluconeogenesis, the production of glucose from non-carbohydrate sources. While cortisol also affects the immune response, bone metabolism, and thyroid function, its primary function in the body is related to glucose regulation. 20. Which of the following is a clinical manifestation of hypothyroidism? A. Heat intolerance. B. Tachycardia. C. Weight gain. D. Diarrhea. Answer. Weight gain. Rationale. Weight gain is a common symptom of hypothyroidism caused by a slow metabolism due to insufficient thyroid hormone. Heat intolerance, tachycardia, and diarrhea are typically associated with hyperthyroidism, not hypothyroidism. 21. What is the most likely cause of primary adrenal insufficiency? Addison's disease? A. Autoimmune destruction of the adrenal glands. B. Excessive cortisol production. C. Insulin resistance. D. Tumor in the thyroid gland. Answer. Autoimmune destruction of the adrenal glands. Rationale. Addison's disease is most commonly caused by autoimmune destruction of the adrenal glands, leading to insufficient production of cortisol and aldosterone. Excessive cortisol production is seen in Cushing's syndrome, and insulin resistance is seen in type 2 diabetes. Tumors in the thyroid gland cause thyroid disorders, not adrenal insufficiency. 22. A patient presents with a low TSH level, high T3, and high T4. Which condition does this suggest? A. Primary hyperthyroidism. B. Hypothyroidism. C. Secondary hypothyroidism. D. Graves' disease. Answer. Primary hyperthyroidism. Rationale: a low TSH level with high T3 and T4 suggests primary hyperthyroidism, where the thyroid gland is overproducing thyroid hormones, suppressing TSH production. Hypothyroidism would present with low T3, T4, and high TSH. Secondary hypothyroidism would show low levels of both TSH and thyroid hormones. Graves' disease is a cause of primary hyperthyroidism. 23. Which of the following would be a typical sign of diabetic ketoacidosis, DKA? A. Hyperventilation. B. Decreased urine output. C. Hyperthermia. D. Bradycardia. Answer: hyperventilation. Rationale: hyperventilation, Kussmaul breathing, is a typical sign of DKA as the body attempts to correct metabolic acidosis. Decreased urine output is more commonly seen in dehydration or kidney dysfunction. Hyperthermia can occur in infection, and bradycardia is not typically associated with DKA. 24. Which diagnostic test is most commonly used to confirm a diagnosis of type 2 diabetes mellitus? A. Fasting blood glucose test. B. TSH level. C. Serum cortisol level. D. 24-hour urine test for creatinine clearance. Answer: fasting blood glucose test. Rationale: a fasting blood glucose test is commonly used to diagnose type 2 diabetes. A fasting glucose level of 126 mg per deciliter or higher confirms diabetes. TSH levels are used to assess thyroid function, serum cortisol is used to assess adrenal function, and a 24-hour urine test is for kidney function, not diabetes diagnosis. 25. A patient with hyperthyroidism is prescribed radioactive iodine. What is the goal of this treatment? A. To suppress thyroid function. B. To stimulate thyroid function. C. To destroy part of the thyroid gland. D. To prevent thyroid hormone synthesis. Answer: to destroy part of the thyroid gland. Rationale: radioactive iodine treatment aims to destroy a portion of the overactive thyroid gland, thereby reducing thyroid hormone production. It does not stimulate the thyroid, prevent synthesis, or suppress function without targeting the gland. This is used as a treatment for conditions like Graves' disease. 26. Which of the following is a key complication of untreated hypothyroidism in the elderly? A. Myxedema coma. B. Diabetic ketoacidosis. C. Thyroid storm. D. Adrenal crisis. Answer: myxedema coma. Rationale: myxedema coma is a severe complication of untreated hypothyroidism, often triggered by stress or infection in the elderly, leading to a life-threatening decrease in mental status and body temperature. Diabetic ketoacidosis, thyroid storm, and adrenal crisis are not directly related to hypothyroidism. 27. Which lifestyle modification is most important for managing type 2 diabetes? A. Increasing physical activity. B. Decreasing potassium intake. C. Limiting iodine consumption. D. Increasing protein intake. Answer: increasing physical activity. Rationale: increasing physical activity is a key component of managing type 2 diabetes as it helps improve insulin sensitivity and reduce blood glucose levels. Decreasing potassium, iodine, or protein intake is not typically required for diabetes management unless there are specific coexisting conditions like kidney disease. 28. A 45-year-old male with hypertension and obesity is diagnosed with Cushing's syndrome. Which of the following is a common sign of this condition? A. Weight loss. B. Moon face. C. Low blood pressure. D. Tremors. Answer: moon face. Rationale: a moon face is a characteristic sign of Cushing's syndrome, where excess cortisol leads to fat deposition in the face. Weight loss is not a sign of Cushing's syndrome, as patients typically gain weight, particularly in the trunk area. Cushing's syndrome leads to high, not low, blood pressure and does not typically cause tremors. 29. Which of the following would be an appropriate nursing intervention for a patient with adrenal insufficiency during an acute adrenal crisis? A. Administer corticosteroids immediately. B. Restrict fluid intake. C. Administer high doses of insulin. D. Increase sodium intake. Answer: Administer corticosteroids immediately. Rationale: during an acute adrenal crisis, immediate administration of corticosteroids is essential to replace deficient cortisol. Restricting fluid intake would worsen dehydration. Insulin is not indicated unless there is coexisting diabetes, and increasing sodium intake is not the priority. 30. Which of the following is a potential side effect of long-term corticosteroid therapy? A. Hypoglycemia. B. Osteoporosis. C. Hyperthyroidism. D. Hyperkalemia. Answer: osteoporosis. Rationale: long-term corticosteroid use can lead to osteoporosis due to its effect on calcium and bone metabolism. Hypoglycemia is not a common side effect. Corticosteroids generally increase blood glucose levels. Hyperthyroidism and hyperkalemia are unrelated to corticosteroid therapy, which may actually lower potassium levels in the body. 31. A patient with type 1 diabetes is experiencing diaphoresis, tachycardia, and confusion. What is the most likely cause? A. Hypoglycemia. B. Hyperglycemia. C. Diabetic ketoacidosis. D. Thyroid storm. Answer: hypoglycemia. Rationale: the symptoms of diaphoresis, tachycardia, and confusion are characteristic of hypoglycemia, a common complication of insulin therapy. Hyperglycemia typically presents with increased thirst, urination, and fatigue. Diabetic ketoacidosis and thyroid storm involve different symptoms and are more severe conditions. 32. Which of the following laboratory findings is indicative of Graves' disease? A. Elevated TSH and low T4. B. Low TSH and elevated T3/T4. C. Elevated cortisol levels. D. Elevated blood glucose levels. Answer: low TSH and elevated T3/T4. Rationale: Graves' disease, a form of hyperthyroidism, is characterized by low TSH levels and elevated T3/T4. Elevated cortisol is associated with Cushing syndrome, and elevated blood glucose is more likely seen in diabetes. Elevated TSH with low T4 would be indicative of primary hypothyroidism. 33. Which of the following is a characteristic sign of hyperaldosteronism? A. Hypertension and hypokalemia. B. Hypotension and hyperkalemia. C. Increased thirst and urination. D. Increased calcium levels. Answer: hypertension and hypokalemia. Rationale: hyperaldosteronism results in sodium retention, leading to water retention, increased blood pressure, hypertension, and loss of potassium, hypokalemia. Hypotension and hyperkalemia would be seen in conditions like Addison's disease. Increased thirst and urination are common in diabetes, and elevated calcium levels are associated with hyperparathyroidism. 34. Which complication is most commonly associated with untreated hyperthyroidism? A. Cardiac arrhythmias. B. Acute renal failure. C. Stroke. D. Osteoarthritis. Answer: cardiac arrhythmias. Rationale: untreated hyperthyroidism can lead to tachycardia and arrhythmias, which can be life-threatening. Acute renal failure, stroke, and osteoarthritis are not commonly associated with hyperthyroidism. 35. What is the primary role of the nurse in the management of diabetic ketoacidosis, DKA? A. Administer insulin and fluids. B. Provide a high-protein diet. C. Monitor for hypokalemia. D. Administer corticosteroids. Answer: administer insulin and fluids. Rationale: the primary management of DKA involves administering insulin to reduce blood glucose levels and fluids to rehydrate the patient. A high-protein diet, monitoring for hypokalemia, and administering corticosteroids are not part of the initial management for DKA. 36. Which of the following signs is most commonly seen in a patient with hypothyroidism? A. Weight gain. B. Increased energy levels. C. Tachycardia. D. Exophthalmos. Answer: weight gain. Rationale: weight gain is a common sign of hypothyroidism due to a slowed metabolism. Increased energy levels, tachycardia, and exophthalmos, bulging eyes, are more associated with hyperthyroidism. Answer: weight gain. Rationale: weight gain is a common sign of hypothyroidism due to a slowed metabolism. Increased energy levels, tachycardia, and exophthalmos, bulging eyes, are more associated with hyperthyroidism. Answer: administer hydrocortisone. Rationale: in an acute Addisonian crisis, immediate administration of hydrocortisone is required to replace deficient cortisol. Increasing fluid intake and providing a high-protein diet are not sufficient in an acute crisis. Sodium intake is typically not restricted in Addison's disease. 38. Which condition is most likely to result in secondary hyperparathyroidism? A. Vitamin D deficiency. B. Hypercalcemia. C. Hypothyroidism. D. Hyperthyroidism. Answer: vitamin D deficiency. Rationale: vitamin D deficiency can lead to secondary hyperparathyroidism because low vitamin D results in decreased calcium absorption, triggering an increase in parathyroid hormone, PTH, to compensate. Hypercalcemia, hypothyroidism, and hyperthyroidism are not directly related to secondary hyperparathyroidism. 39. A patient with hypothyroidism is prescribed levothyroxine. When should the nurse administer this medication? A. Before meals. B. With meals. C. After meals. D. At bedtime. Answer: before meals. Rationale: levothyroxine is best absorbed when taken on an empty stomach, typically 30 to 60 minutes before meals. It should not be taken with meals as food can decrease its absorption. It is not recommended to administer levothyroxine at bedtime or after meals. 40. A patient with type 2 diabetes mellitus is prescribed metformin. Which of the following is the primary action of this medication? A. Increases insulin production. B. Increases glucose uptake by the cells. C. Decreases glucose production by the liver. D. Stimulates pancreatic beta cells. Answer: decreases glucose production by the liver. Rationale: metformin primarily works by decreasing glucose production in the liver and improving insulin sensitivity. It does not directly increase insulin production or glucose uptake. It does not stimulate pancreatic beta cells, which is the action of other medications like sulfonylureas. 41. Which of the following symptoms would indicate a thyroid storm? A. Fever, tachycardia, and confusion. B. Weight gain, bradycardia, and fatigue. C. Hypertension, nausea, and dizziness. D. Increased thirst, frequent urination, and fatigue. Answer: fever, tachycardia, and confusion. Rationale: thyroid storm is a medical emergency characterized by fever, tachycardia, confusion, and other signs of severe hyperthyroidism. Weight gain, bradycardia, and fatigue are more common in hypothyroidism. Hypertension, nausea, and dizziness are nonspecific and could be related to other conditions. Increased thirst and urination are typically seen in diabetes. 42. A patient presents with a neck mass, hoarseness, and difficulty swallowing. What condition should the nurse suspect? A. Thyroid cancer. B. Hyperthyroidism. C. Diabetes mellitus. D. Cushing syndrome. Answer: thyroid cancer. Rationale: a neck mass, hoarseness, and difficulty swallowing are common signs of thyroid cancer. Hyperthyroidism generally does not cause a neck mass, and diabetes mellitus and Cushing syndrome are unrelated to these symptoms. 43. Which electrolyte imbalance is most commonly seen in patients with Addison's disease? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypocalcemia. Answer: hyperkalemia. Rationale: Addison's disease causes aldosterone deficiency, leading to potassium retention and hyperkalemia. Hypokalemia, hypercalcemia, and hypocalcemia are not commonly seen in Addison's disease. 44. Which of the following is the most common cause of secondary adrenal insufficiency? A. Pituitary adenoma. B. Autoimmune destruction of the adrenal glands. C. Hemorrhage into the adrenal glands. D. Excessive corticosteroid use. Answer: pituitary adenoma. Rationale: secondary adrenal insufficiency is often caused by pituitary adenomas, which disrupt the secretion of ACTH. Autoimmune destruction of the adrenal glands leads to primary adrenal insufficiency. Hemorrhage into the adrenal glands causes acute adrenal insufficiency. Excessive corticosteroid use can lead to suppression of the hypothalamic pituitary adrenal axis. 45. What is the most common treatment for hyperparathyroidism? A. Surgical removal of the parathyroid glands. B. Radiation therapy. C. Chemotherapy. D. Calcium supplementation. Answer: surgical removal of the parathyroid glands. Rationale: surgical removal of the parathyroid glands is the most common treatment for hyperparathyroidism, especially when it causes significant symptoms. Radiation therapy and chemotherapy are not used to treat hyperparathyroidism, and calcium supplementation may worsen hyperparathyroidism by increasing calcium levels. 46. Which of the following is a common side effect of thyroid hormone replacement therapy? A. Weight loss. B. Anxiety. C. Hair growth. D. Hyperglycemia. Answer: anxiety. Rationale: anxiety is a common side effect of excessive thyroid hormone replacement, as it can lead to symptoms of hyperthyroidism. Weight loss, hair growth, and hyperglycemia are not typically caused by thyroid hormone replacement therapy. 47. What is the primary concern in a patient diagnosed with hyperthyroidism and cardiac arrhythmias? A. Risk of stroke. B. Risk of heart failure. C. Risk of thyroid storm. D. Risk of diabetic ketoacidosis. Answer: risk of heart failure. Rationale: hyperthyroidism, when accompanied by cardiac arrhythmias, increases the risk of heart failure due to the increased workload on the heart. Stroke and thyroid storm are potential risks, but are not as directly associated with arrhythmias. Diabetic ketoacidosis is unrelated to hyperthyroidism. 48. A nurse is caring for a patient with hypothyroidism. Which of the following is a priority in the care plan? A. Administering levothyroxine as prescribed. B. Encouraging a high-protein diet. C. Increasing fluid intake. D. Monitoring blood glucose levels. Answer: administering levothyroxine as prescribed. Rationale: the primary treatment for hypothyroidism is levothyroxine, which should be administered as prescribed to restore normal thyroid function. A high-protein diet and increased fluid intake are not priorities in the management of hypothyroidism, and blood glucose monitoring is typically not needed unless there is comorbid diabetes. 49. Which of the following is a key symptom of pheochromocytoma? A. Hypertension. B. Hypotension. C. Hyperglycemia. D. Increased thirst. Answer: hypertension. Rationale: pheochromocytoma, a tumor of the adrenal medulla, causes episodic or sustained hypertension due to excess catecholamine release. Hypotension, hyperglycemia, and increased thirst are not common in pheochromocytoma. 50. A patient with diabetes presents with a deep, fruity odor to their breath. What is the most likely cause? A. Diabetic ketoacidosis. B. Hyperglycemia. C. Thyroid storm. D. Adrenal crisis. Answer: diabetic ketoacidosis. Rationale: a fruity odor to the breath is characteristic of diabetic ketoacidosis, which occurs when the body produces ketones as a result of uncontrolled hyperglycemia. Hyperglycemia alone does not produce this odor, and thyroid storm or adrenal crisis would present with different symptoms.